Dan, you're sergeant, right? Is your title sergeant?
He's acting lieutenant.
Yeah, I'm
Acting
the
lieutenant. Okay.
acting lieutenant of the COU. Yeah, yeah,
Thank you. Want to get that right.
yeah.
Welcome, everybody. We'll get started in just a minute. All right. I see some familiar names in our audience, so I wanted to welcome everyone tonight for one of the first nights for the Hawaii Book and Music Festival. We have a really interesting panel tonight and an interesting topic that I hope you all will enjoy. And I'm lucky enough to bring to you some of my very esteemed colleagues that I get to call partners in the work addressing homelessness here on Oahu. And tonight we're really focusing on wellness, a unified approach to homelessness. And this is very, this is a very important topic at this point when we've all been living through the pandemic over the last almost 2 years now, and really looking at how we can address a long-time issue in our community, that of homelessness, in a new light, and that being COVID. And so tonight we're going to be looking at how COVID has impacted and caused implications addressing the issue of homelessness, and whether or not there's some silver linings in some of the things that have been going on over the last year and a half. We'll also be looking at some of the programs that have come up with COVID, with some extra monies that have been coming into our state, and addressing some of those through the behavioral health system and through HPD. And so my name is Laura Thielen, and I'm the Executive Director of Partners in Care. Simplest way to think about what we do at Partners in Care is we're a support organization for all those who provide homeless services and housing to folks who are experiencing homelessness on Oahu. I am part of our continuum of care, and with us we have some really great speakers. So throughout this conversation, please feel free to put any questions into the chat, and we will address those questions as we go through this hour-long talk. This is a conversation, not a lecture. So hopefully you will join in and give us your thoughts, ideas, your concerns, and help us mold what the future will look like in addressing homelessness. So to start us off, we've got Connie Mitchell, as and many of you probably know Connie. She runs the IHS, the Institute for Human Services emergency shelter, the biggest emergency shelter on Oahu. But IHS is so much more than just the shelter at Sumner Street. They have a men's shelter on Sumner Street, a women and family shelter over on Ka'ahi Street. They have Tutu Birds, which really focuses on medical folks who need to come out of the hospitals and don't have anywhere to go. And they have outreach and so much more. So Connie is a vital part of our continuum of care, and we really appreciate having her here. Next, we have Scott Morishige, and Scott is from the governor's office. He's the governor's coordinator on homelessness, and he has a long history of working with folks within our community, both at Helping Hands, at Focus, and now at the governor's office. So welcome to Scott. He's been a great advocate for those who are experiencing homelessness in our community. And then lastly, we have Acting Lieutenant Joseph Dan O'Neill. We all call him Dan. He is with the Honolulu Police Department. And despite what some think, we are great partners with our Honolulu Police Department. And we have forged a lot of great partnerships and programs along the way. And during COVID, it's been especially important that we both grow that partnership and make it as good as it possibly can be, because we can make it a win-win situation with our folks if we keep them out of jail and get them into housing. And so Dan will specifically be focusing tonight on the Honu program. So we'll talk a little bit about that. There's definitely been some ups and downs over the last couple of years, but we'll go ahead and get started. And so I am going to toss it over to Connie. Connie's going to share a couple of slides for us and talk a little bit about the continuum of care in our community.
Thanks, Laura. I think I just wanted to start by saying that as a service provider, one of many on Oahu, I can't remember how many membership we have in the Partners in Care. Laura, maybe you can kind of help us with that number, but
probably about 64.
Right, so there's so many people who have come together to really look at the problem of homelessness. And when we talk about a unified approach, sometimes it's kind of challenging. So I just wanted to share with you this slide that I have here. We're in this service continuum, this yellow circle. And as Laura mentioned, there's like 60 plus service providers. And then there's other people that also may not be members of Partners in Care, but also do things. They're from the faith communities, or they're doing outreach, of their own. And then, we're embedded in this community of policymakers and then also the general public. And within our continuum, there's all different types of services. We kind of start here with the engagement or outreach, and the outreach comes in a lot of different forms. There are many outreach teams that are assigned to different regions of the island. There's also different types of outreach going on. Some particularly with people with medical needs. Street medicine is one of those types of outreach where people are really getting wound care right on the street. We have mental health outreach specifically for people who are impaired by their illnesses. And then there's other outreach, that is really focused on housing navigation, or just rehousing people or getting them into shelter and then into housing. So there's, other things going on also. And then we have case management, just providing the supports that people need, connecting them with the services that they require to get out of homelessness. Data management is another thing we do together with Partners in Care. They have the management of information system for all of homelessness, but each of the service providers that are contracted by the state or the city are required to put information into that system. And then we have stabilization services, and these are the treatment services that really help people just be healthier and be able to get into housing and stay in housing. We have employment support to increase income and also give people purpose and like a sense of direction in their lives. And of course, the housing placement services actually get them into housing. And we have other supportive services which come actually right after outreach usually, which is to provide emergency shelter or the basic needs like meals or like a place to have their hygiene needs met. So many different organizations and doing all different things. And then we're in the middle of a lot of other people telling us what to do. No, they're actually really partners with us, but you can see that there might be a lot of different perspectives from the government and also from private foundations. So if you look at this slide, like this particular week, I'm going to be speaking at a neighborhood board, down in downtown Chinatown. And, we often go and talk to the city council about, things that are maybe good policy or not good policy, speaking with the judiciary to change the way that people are brought through the system so that we can get the outcomes that we want, so we can actually treat people more quickly and, more effectively. But if you look around, all of these different agencies of the state and of the city county of Honolulu includes the police, actually EMS should be in here also, the Department of Community Services, the Department of Planning and Permitting, and their housing department, which also includes homelessness. So as you can see, all these people are people that we answer to in a lot of ways, but we also look at them, for partnerships. So I just wanted to give you guys a sense of that in terms of how we're embedded. And during this time of COVID, this last almost 2 years now, we've been really kind of having to change gears a lot. But a lot of the different people who have priorities for us, they were kind of all, not put aside, but we had to remember that there's this whole layer of COVID over all the things that we were doing. And I can say that I'm super grateful that, before COVID, we seem to be, trying to come together to do more in collaboration. But I think one of the good things about COVID, the COVID pandemic, is that it really, truly brought a lot of us together because of some of the meetings that, Scott convened from his office, but also from Partners in Care, just sharing information with everybody around COVID. So, I just look back on our last year and I think about how, we were really, some of the roles that we also played was trying to make sure that we took back the homeless people from the hospitals and they didn't stay in there. That we also were trying to prevent community spread, but also outbreaks within our community of homeless people, whether they were unsheltered in encampments or whether they were in our shelters. And then, of course, doing the vaccinations and really trying to get as many people vaccinated as possible among our homeless community. And then, when people were found to be positive, getting them to isolation and quarantine in an efficient way. So I think, it gave us an opportunity in the process, because last year we also, IHS particularly ran with Hawaii Health and Harm Reduction Center and H4, a temporary quarantine and isolation center. And that was an opportunity to not only address the COVID needs of our homeless people, but also to address some of the behavioral health needs and stabilize them. But I'll stop here. I'm sure there's going to be lots more questions around, a lot of the things that we've done. Thank you.
Thank you, Connie. Yeah, that was a great introduction. And I think a couple of the key words that I kept on hearing throughout the last year and a half, 2 years, was the ability to pivot. And I think providers had to pivot an awful lot because it seemed like every day there was a change in protocols and addressing things. At the very beginning of the pandemic, your shelter, along with many others, had to depopulate. And so that really made all of us have to work together to figure out how are we going to do that without risking the lives of folks who were going to be needing to get out of the shelter. And so that to me was one of the silver linings, is the ability to pivot quickly and recognize that we can do that. There were many bumps along the way, but setting up things that we never thought we could set up before, like stabilization beds and things like that, we were able to actually prove throughout the pandemic that these necessary changes will actually go into the future. And with that, I'll turn it over to Scott, because like Connie said, he helped convene quite a few of those meetings to make those pivots possible. So go ahead, Scott.
Yeah, thank you, Laura. And I just wanted to share a couple slides. I think Connie did a really good job of talking about the unified approach that we had to take, but I found it's very helpful to show pictures, because I think a picture is worth 1,000 words. And I want to start with this picture. This is from a coordinated outreach event that happened just a couple months ago in June. I think it shows many different players that came together during the pandemic. So in this picture, we have, HPD officers in plain clothes, we have nurses, we have homeless outreach providers, we have mental health providers, we have staff from my office, and staff from the city and county as well. So I think it shows how everybody really had to step up. And our providers, what a lot of people may not realize, is our homeless service providers were very much frontline providers during the whole pandemic, those in shelters and those doing outreach, just as much as our hospital workers are frontline providers. And I think that's just something I wanted to really kind of show how our community came together. And in part, one of the biggest challenges, like Laura and others had shared, is we really had to go out and make sure that we could make testing available and vaccination available to the population that we serve. And what I think many people sometimes forget is the pandemic, as difficult as it was for those of us with homes, for people who do not have a place to stay, it was really just such a drastic change to their lifestyle and just well-being. I remember after the lockdown took place, I was speaking to some of the individuals that I would see who are homeless outside the state capitol where I work. And they were telling me just how difficult it was, because all the places they would go to hang out during the day, like the library or McDonald's, places they would go just to, socialize or to get in outside from the hot sun, those places were shut down. A lot of people were cut off from having places to use the bathroom, to charge their phone. And so we worked really quickly, not only to have coordinated efforts to increase vaccination and testing, such as what's shown in these pictures here, but in the early days of the pandemic, we at the state convened a lot of meetings. Well, how do we open our restroom facilities? City and county did the same. And we partnered together with community groups we had never partnered with before to be able to see how could we continue to make some of those public facilities accessible. In particular, though, the vaccination and testing efforts more recently have been really key, because what some of us take for granted is, getting vaccinated for someone experiencing homelessness is not as easy as it may be for some of the others of us, because a lot of times what's required for you to get a vaccination is having photo ID, and many of the population we work with do not have that, or they may not be able to have a car and go to a drive-through clinic. So we work with partners such as Project Vision Hawaii, the UH Home Project, and others who really went all of their way to make sure these services are accessible. And then we got together and would have weekly meetings with outreach to target where vaccination testing may be needed and how we could respond to emerging needs during the pandemic. I know we've had a bunch of different meetings, webinars, and various forums to share information. And I think those were really key, because as Laura mentioned, things are changing on a day-to-day basis. But throughout all of this, we really wanted to keep a focus on making sure people had access to shelter and housing as well. The other thing I really want to emphasize is the providers, and particularly partners in care, organizations like IHS and others, really kept the focus on housing despite the pandemic and despite the many challenges. And placements into permanent housing continued despite COVID-19. So what I'm showing on the screen here is a dashboard that can be found on Partners in Care's website, partnersincare.oahu.org. And it shows this is an initiative that started in late April. And just in the 5.5 months or so, they've been able to house 203 households, over 533 individuals represented in those households in a very short amount of time, many people being housed in just 15 to 16 days, and they're making that data transparent and accessible in real time. Our ability, programs like this that house people rapidly leverage federal resources that are coming in to our community, some for the first time. We have a really unprecedented level of federal funding now available, including emergency housing vouchers, increased funding to the CARES Act, American Rescue Plan Act, and we're putting that funding into action through programs like this. And one of the unique things about Oahu Housing Now is not the effort of just one provider. It's a hui of different providers and our whole system really coming together, making sure we can take a unified sort of centralized approach to how we house people. And it's not only resulting in more people being housed, but it's also modeling a way that we can continue to house people more quickly, moving forward even past the pandemic. Then I wanted to just kind of close by showing some examples from across the state. Again, really show beyond just the outreaches, beyond just numbers on the dashboard, how the community did come together to respond and meet the many challenges we faced during the pandemic. The first picture on the left is of Halahanakahi. That's a tiny home structure, tiny home shelter community that came up in Hilo on the Big Island. And the Big Island, just like many other parts of our state, they were experiencing reduced shelter bed capacity, and they needed to figure out how do they address that really quickly. There were some people that were able to partner with hotels and put them in temporarily in hotels, but for others, they had members of the community come over together during one weekend, the fire department, service providers, other government workers, and they assembled these tiny homes from scratch, and it added increased capacity in their community. Here on Oahu, we're very grateful for the partnership of Lieutenant O'Neill and HPD to really look at how do you innovate, how do you take a program like the Honu, which had just launched a few months before the pandemic, and really be flexible and design it in a way that could be easily scalable during the early days of COVID-19. So switching from these large tents that would house multiple people at one time to an individual tent model, and really trying to figure out how do you provide space so people could isolate and quarantine and keep the program flexible. That's the picture on the upper right. And on the bottom right is one of our newest housing projects, which we're hoping to open possibly later this month. And this is the Kamaoku Kauhale project. This is a project out in Kalailoa at Barbers Point that our Lieutenant Governor, Homemade Hawaii, many other partners came together to build during the pandemic. And this is going to add 36 additional units, permanent housing units for people to transition from homelessness into these homes. So we're continuing to keep the focus on permanent housing in many ways, not only through initiatives like Oahu Housing Now, but continuing despite everything going on to also try to add new inventory at the same time. So I know many of you probably have many questions. I hope I didn't kind of go over my time, but if anybody wants to follow up, you can either ask your question here or just reach out to me at any time, and my information is here on the screen, 586-0193, or you can email gov.homelessness@hawaii.gov or check out our website, homelessness.hawaii.gov at any time. But thanks, Laura. I'll turn it back to you.
Yeah. Thanks so much. So much of what Scott said, really plays into all the different things that have been happening over the last couple of years, but also what's been happening over the last couple of decades as the issue of homelessness has increased and become a really big issue for our community. And I think one of the big things that we recognized, and I think this pandemic has brought to the forefront, is that homelessness is a crisis. And I think, we as a community, in some ways, we're getting used to the issue of homelessness. and that it was never going to go away. And I think, we need to re-emphasize that homelessness is a crisis, and also the fact that housing is healthcare. COVID monies have come into our state, and they're specifically being used for housing folks so that they can be in the safest place possible during a pandemic, which is in their own unit. And that will help us pivot towards what Acting Lieutenant Dan will talk about with the Honu and the Post, because that's become a navigation center to help people in their different pathways. And also recognizing that, what Scott has shown you on those a couple of pictures is that there's not one answer. There's not one type of housing that's going to work for everyone, and that we really have to put emphasis on different pathways for people to get into housing and out of homelessness. Because unless you put them in the right pathway that they are part of deciding on, they probably won't be successful. So they need to be part of that discussion and part of that creation of programs. So with that, I'll turn it over to Dan to talk a little bit about his program.
Hello, good evening, everyone. I'm so glad to be here. I'm Acting Lieutenant Joseph O'Neill, the Community Outreach Unit. So I'm going to briefly discuss the Honu program, some of the thought behind it, and then how it's currently operating during the pandemic. But I wanted to start by stressing that the Honu program would not have been possible without the generosity of Scott Morishige and taking a chance on a homegrown program that had no playbook, hadn't been done anywhere else. Providers such as IHS, Connie, Laura, Pick, and many of our partners that have given their time and effort into Honu, because Honu really is a community program. So what it stands for is the Homeless Outreach and Navigation for the Unsheltered. The program was born out of the idea, it was myself and I'm sure some of you know him, Major Mike Lambert. We realized there was a problem, not just the way that police approached our unsheltered members of the community, but in the amount of diversion, and that enforcement cannot solve the problem of homelessness. HPD takes, I think, about 1 million calls for service a year, and a large portion of those are non-emergency. So, and a huge percentage of those are related to things the community see as nuisance complaints. Maybe it's an unsheltered member of the community sleeping at a bus stop, or a homeless person. For each of these encounters, that's an opportunity that a police officer could offer a more permanent solution into something. So the idea with Honu was that, officers aren't ever going to be social workers or as skilled as people like Connie and Scott and Laura, but how can they not have to learn the complex system of navigation and shelters and get someone into services in the moment that they want help? So the design of Honu was that a patrol officer or even a social service provider at any time of the day could refer someone into the Honu as think of it as a mobile, it's a navigation center, but almost like a train station, to where the person referring would not have to know the complexities of the shelter system. They wouldn't need to worry about categories of bed space that may affect our brick and mortar shelters. If it's an officer, all they would need to do is ask the person, do you want help? And if the person said yes, once they were transported to Honu, civilian non-officer case management will do an intake with the person, get them into a temporary living facility, such as an air shelter or a tent, and the person would be allowed to talk to the case management person about where would be the best fit for them, what part of the community they could return to and have the best result. But Honu was designed as just the catch-all. So it wouldn't matter if it's midnight, 1 a.m., 2 a.m. All a person needed to do was say, I want help. They could come to the Honu facility and then go on to the more permanent programs, such as facilities like IHS or the things that Scott was showing. During the pandemic, we realized that we still wanted to offer this 24-hour service, but we dealt with the complex challenge of social distancing and creating safety for the people that wanted to come into Honu. And that's where the picture that Scott showed with the tents was, we had to alter the model to where people could still come into the Honu 24 hours a day, but we had structured social distancing. This was still all voluntary. The Honu was, anyone was free to leave at any point in time, but we realized that it had to be low barrier, and we had to have a place that our homeless members of the community could feel safe just like our house members, because when you have a stay-at-home order, it's not really fair to the house members of the public if, say, a police officer doesn't enforce a mask rule or a park closure on the unsheltered members, but then they enforce a rule on the sheltered members of the community. So we wanted to have this option as well, to where someone would have a place if they wanted to receive safety. The Honu program has operated in a pandemic mode since April of last year, and during that time, we've assisted about 1,900 people. That's individual people that have come through and received at least one night of shelter. At the Honu, we're able to provide meals, COVID testing. Even groups have come in and done vaccination in the site. IHS is on site doing medical checks and services. But it really is a community center. And I'll show a picture. I'll screen share so you can see what I'm trying to describe. Let's see here.
And can you go into a little bit, Dan, about how it moves and the process for that?
So this is what the Honu looks like now. The idea about the movement was that when the Honu was designed, we knew that sometimes the community, there's that sense a lot of times of not in my backyard. So new initiatives and programs, brick and mortar shelters, they get a lot of pushback. So we knew we wanted to be environmentally conscious, not have a permanent effect on any one community. We called it the shared burden model. So we realized also through outreach that in an area like Wahiawa or Waimanalo, the people from that area, it's not really reasonable to tell a homeless encampment that you must pick up and move to town or else you're going to face enforcement. So we designed it as mobile to where we could deploy into an area of need very quickly. These shelters that you see on the screen, they can be deployed in about 4 minutes. The frames are airframes, and they reflect 60% of the heat, and they can withstand 75 miles an hour in a wind. So it's a very robust structure as far as, like, glorified camping. It's very, very cool. It's actually pretty comfortable. We've never had any complaints about staying in there. But the point of the mobility was that how can we launch this thing within hours? And then if we had a family that wanted help at 1 a.m. or a single male, single female, any category you can think of, we could launch another structure within minutes and accommodate that category. So with the mobile model, we deployed in the Waipahu Cultural Gardens for about 90 days, and then we went to the Stadium Park, and the pandemic struck, so we went to the Kehi Lagoon and Lehua, and now we have a second Honu at the Oniula Beach Park. We were in Whitmore before we in Oniula, but the mobile model has been very effective because you can go right to a community that is a need and triage that community in a way that fits that community. So one size fit all, we realize does not work. So each community has its own challenges, and I think the way that we've been able to launch this mobile navigation center that's been the success of the program. And the police involvement is very important because the officers that work the Honu are in plain clothes. They're not in uniform. It's not an enforcement program. We don't run people for warrants. Originally when we launched this, the idea was that we had heard, some naysayers had said that people wouldn't want help from the police if they're at the facility. They might feel like it's a jail or whatnot. But I can tell you that since the program launched in December of 2019, so we're on our a little over our second year, the program has helped 2,300 unique individuals that have come through, and we've navigated into a more permanent living arrangement, such as shelter, reunification with family, about almost 1,200. And I think providing the safety for people, and they know that some of the feedback we received was the police presence was very welcome because the individuals on site know they have very robust care. So not that a private security guard wouldn't be as attentive as a police officer will, but people know they can lay their heads down and be safe, and no one's going to victimize them. They're not going to be swept in some kind of enforcement. They can really receive services and have safety. And people are free to come and go. They can go and work jobs. We provide power through solar panels to the individuals on the site. We take care of all the trash. 2 meals a day are provided by providers, HPD, MREs, and then donations such as IHS. River of Life provides a ton of meals out there. And it really it really has been successful as far as a homegrown model of a catch-all site that brings in the community and brings in partnerships, because we just realized that other places, a lot of, and even here before this program existed, sometimes there's silos, and the police versus social service have an us versus them, enforcement and harm reduction or outreach. But when you bring everyone together and you do something like this, I feel that's why we've had so much success, because it's very innovative. And I don't believe, from what I found, that the numbers based on what we know of our last point in time count in our unsheltered population, that there's a nationwide program that has had the volume and the success as far as how many touches as the Honu has had, and that's because it is so low barrier. I mean, any individual can come in there, and Laura can speak to this too. She knows, and so does Connie and Scott. But you can have no ID, you can have no documents, you can have no money, you can bring in your animals. We even let people sleep with their animals in their shelter, and that's kind of big because it's comfort, right?
Yeah, and the low barrier, as well as, one of the things that's been key is, and Dan touched on it a minute there a little while ago, the need to address people's needs when they're ready to address them. So when a police officer or a community member meets somebody out in the community, and it's 10 o'clock at night, and they say, "I'd love to go to shelter," but 3 hours earlier they were asked the same question and they said no. At 10 o'clock, there's really not any option to go into shelter. And so the Honu has definitely provided that type of a low barrier. At any point in time, they can provide transportation to the site. And for many people, like Dan said, I think some of them were nervous about going there, but when that's the only option, or giving it a try, it's amazing how many people did want to participate. And I think we also saw that at some of the isolation and quarantine facilities as well, and how those kind of turned into stabilization beds. It's people were very scared, and still are, about the pandemic, and if they get sick, they need to stay somewhere safe. And so I know that several people went into the isolation and quarantine facilities, and it was, for some of them, it was the first time in a bed for quite some time. And being able to spend a couple of days and being taken care of enabled them to make some different decisions, or new decisions that they hadn't thought of before. And their pathway changed instantly. And I know, with IHS and Harm Reduction Hawaii and other providers, they were able to leapfrog into their pathways towards housing, whether that was into a transitional facility or straight into independent housing. And that's what's really important here is, we talk a lot about the continuum of care and the continuity of care, and the need for all of us as providers to be really engaged with our folks we're working for, which are those who are experiencing homelessness, as well as all the government entities, to make sure that at any point we can leapfrog the continuum. And if somebody's ready to go into independent housing and is capable of that, we need to have the resources ready for them to do that. That's been one of our struggles, I think, across the board, is we don't have a ton of resources. Right now, we're fortunate. We've got a lot more than we usually have in our continuum with COVID-related funds, but eventually those will go away. So, one of the questions that I'd like to bring up is, how do you folks, what are the silver linings or the programs or the ideas that have started in COVID times that you want to see go forward? For me, it's definitely, the increase in permanent supportive housing, increasing our baseline of services that we provide. But what are some of your thoughts on what we should be carrying past COVID, or what lessons have we learned during COVID that we want to make sure continue?
One of the things that we actually had an opportunity to expand in our service line was actually having medical services on site at the shelter, and that has been a huge boon to us because of the COVID, number one. But, I think having the extra medical support has actually stabilized a lot of people in the shelter even more so. And I have to say, when we were, into the Honu or post at the beginning time last year, one of the really interesting things that we observed was when people had to stay in place for a while, they began to face their addictions too, because when you're in the post for a while and you can't really leave, because at that time they were in lockdown, they agreed to stay in place for 14 days and then, move to the next site at that time. Then they realized, oh, I am feeling a little uncomfortable because I need my stuff. I need my alcohol, or, and then they were open, to maybe accepting some services. And that's when I realized, wow, we should really be looking at these opportunities and making sure that anytime somebody comes into any service, if they're in any way interested in getting into detox, that we have that available for people, and to use the medical services to support that. So I'm really happy about the fact that we kind of glommed onto that and are continuing that in many different portals that people come into.
Great. Thank you, Connie. Scott or Dan?
Yeah, Laura, one thing that I really think was a silver lining of COVID, and I really hope will continue, is the use of technology to improve efficiency and quality of care. And I'll give two real examples of what I mean. One is with the emergency rental assistance programs being administered by the counties. It's a huge need to get the money out quickly. And Catholic Charities and Council for Native Hawaiian Advancement and the other providers throughout the state were able to quickly adapt. All of them developed online application processes to get the financial assistance out there. And in fact, recently, last month, the U.S. Department of Treasury recognized the City and County of Honolulu and the Department of Hawaiian Homelands as being two of the most efficient programs in the country in getting rental assistance out to the community. And part of that was through the use of technology. And I'm hoping that's something that will continue to remain beyond the pandemic. And the second example, I think, of how technology has improved care is through the use of telehealth, particularly for unsheltered individuals. And so early on in the pandemic, Department of Land and Natural Resources had called me about a person who was experiencing a mental health crisis out on Diamond Head, and she would not go into an office setting to get assessed. But we were able to work with Care Hawaii, one of our providers. They were able to use telehealth to get this person connected for a mental health assessment, using technology, meeting her where she was at. And we've seen that happen not just in that one case, but in others. So I think that's another example of how technology has improved care. And I really hope these innovations will continue even when we go back to normal and when the pandemic is all over.
Hopefully soon. And Dan?
No, I think that that's a very good question. What I'd like to see is I'd like to see more permanent supporting housing programs come online, because, for instance, to give an example, right now we have 99 people staying in the Honu program between the two sites. And these are all people that don't have anywhere to go within our existing system right now. Honu, like I said, it's a temporary, it was designed as 5 days, you're in and out. Everyone in the Honu wants to go somewhere. They're not just staying there to squat. They want to go to something else, but there's nothing that fits for them. We shouldn't be taking care of 99 people. So I'd love to see that the need is identified on the back end, and maybe more money or support going into providers such as Connie, or the permanent housing, or the small housing programs like Scott showed. That'd be very big. I think Honu has also showed, like Connie had mentioned, there's people that came into the post during the pandemic of Honu, and they went cold turkey because they wanted to be safe from the pandemic. But we noticed there was a lot of people that said that they were heavy drug users, but they had safety in the Honu and the post, and they knew that the way it was designed was you were always free to leave in the quarantine model. But if you left one zone, you would have to restart on the time-based quarantine. This is pre-vaccine in another zone. You were allowed to come back, but we didn't know where you went. So that individual little a group that you were in, you can't go back in there because you could have caught something. So you start in a new intake zone. And we found that people under that thought of, I want to make the 14 days, I want to go on to navigation, have the shelters comfortable with taking me as I'm free of COVID with a time-based quarantine, they fought through urges, they fought through some of their problems. And we had people telling us, that we saved their lives. Even today, a woman in Chinatown gave Officer Ebrau a hug and said that he saved her life. The post saved her life. She said she was going to die out there. And then she went in and she went on to get an apartment in downtown, and she's successful now. And those kinds of stories, even if I think you hear one of those, and then all this effort and hours we put in kind of are worth it for me. I mean, if she really feels we saved her life. So, yeah.
Yeah, great. We've got a couple of questions. Maria asked how many folks are in the Honu, and Dan answered. But basically the Honu, from what we've seen, it can grow and grow and grow to meet the needs of that community. So that's, I think, what's really unique about it. It can shrink in size if there's not as much need, and then it can grow in size if there is need. We're talking right now, thankfully, about all the wonderful things that are happening. But there's still, a lot of community concern about the issue of homelessness. Most recently, there was a story about those folks that are in Waikiki and on the sidewalks and things. And those are very, it's hard for the community to understand that there is actual work being done with those folks as much as they're able to. We've got a lot of severe mental health issues out on the streets. We've got a lot of substance abuse issues on the streets. We have, and in my opinion, and from what I've seen in my 30 plus years of working in this field, we have a lack of resources in substance abuse treatment, and sometimes that's very difficult, to deal with folks out there. Any comments on those kinds of things? I know, Connie, your group is working so hard in Waikiki and other areas, but can you give some insight to our listeners of what is being done on a daily basis, even when it looks like there's maybe not much being done from a community member's perspective?
Yeah, thanks, Laura. I think a lot of people get not mainly concerned, but very much concerned about people who are, behaving in ways that are really bizarre or, very indicative of mental illness. And for us, we do have a special outreach team that tries to identify those people that very often are being taken in for mental health evaluations to the emergency room. And we're working so much closer with HPD now. The police have been awesome, in helping us to determine who the people are in a particular community that seem to be constantly popping up, either being arrested or needing to be taken to the emergency room. So for those people, we do have that program that then begins a process to try to either obtain a guardianship so that somebody else can make decisions and consent to treat for that person, or we get what we call an assisted community treatment order, which allows us to treat the person over their objection because of their mental illness. And it's a very high bar that we have to reach in terms of convincing the judge that this person cannot take care of themselves, and if nobody steps in, they really are going to be at risk for some very serious illness or even death in some cases. And so in Waikiki in particular and in Chinatown, we've been really focusing on really hearing who those people are so that we can do that. This past year too with the legislature, we kind of cleaned up one of the laws that we had to make it easier for us to be able to make this happen, because it was taking too long, and everybody agreed, that it really was in the best interest, for people to get treatment if they needed it. So that's one area that I think we're really trying to step up, and with the partnerships that we've developed with businesses who help us also identify people, and even let us know who they are. It's been really, really helpful.
Great, thank you, Connie. One of the questions that's come up is looking down the pipeline and seeing what's going to come down, especially in regards to those folks who are considered part of the ALICE population. And I always forget what that means, but low income, employed individuals. And I think that kind of is in tandem with the whole eviction moratorium ending and the possibility of a huge increase in the numbers of folks who are experiencing homelessness due to evictions because of non-payment during COVID and other things. And so, you know, I open it up to any discussion on that. You know, we are working very closely with all of our partners to make sure that prevention resources are available to anybody who could qualify for them. But if anybody wants to talk a little bit more about what you think we'll be seeing in the next year or so as this pandemic hopefully peters out over the next year, but what that means for our service industry.
Well, Laura, I think one of the things we need to be mindful of is looking back at when our community and country has experienced past economic recessions, right? And I've shared before that following the 2009 recession, which was not anywhere near the level of magnitude we're seeing now, that we saw a huge increase in homelessness, but it wasn't one time, it occurred over the next several years. I think for us to try to avoid that following this situation, we really need to look at the practices to help people not only access prevention resources, but be able to quickly find housing if they get to a point where they may be displaced or have to move. So I think taking some of the lessons learned from the Oahu Housing Now program and similar rapid rehousing programs and figure out how do we get people housed more quickly and continue to do that and embed that into a regular practice. I think also looking at not only focusing on housing and mental health, but really looking at increasing access to employment programs, so workforce development. I think one of the partners that we didn't recognize in this call was the American Job Centers. Mm-hmm. And there's a program to the city and county, Teamwork Hawaii, which has been a critical partner in providing outreach, but they approach it from an employment lens, helping people get connected to workforce development, to job training, to pivot to another career if that's what's needed. And I think we need to look at those two things. How do we continue to have strong partnerships with the workforce development sector, but also how do we look at continuing to help rehouse people rapidly if they have to move out of their current housing?
Any other thoughts on what we think we'll be seeing come down the pipeline?
I think my hope is that with affordable housing, one of the programs that don't cost as much are shallow subsidy programs. And when we talk about ALICE households, you know, they are income constrained and, you know, they really are barely making it. But if they had a shallow subsidy, it could make a real big difference for some of those folks. You know, so when I talk about shallow subsidy for an individual, it could be maybe $400, maybe a family, maybe you know, $500, $600 a month or a little bit more, but they're working and they just don't make enough. And so what Scott was talking about in terms of workforce, I think our economy needs to pick up enough so that we have more, you know, jobs that pay enough, you know, living wage, you know, that really allows people to afford housing. And at the same time, bring down the cost of housing, because the two are just hand in hand making more homeless, you know.
Yeah, I completely agree. You know, living wage as well as a truly affordable housing. That title has changed quite significantly over the last decade or so, and you know, and that opens it up also to, you know, we really need to encourage landlords to be open to folks with those subsidies. You know, we're one of the few counties that really does not, continues to allow for discrimination against folks who have housing subsidies. So you can actually state in an ad for your unit that you're renting out that you can deny someone who has a housing subsidy. And we'd like to flip that. And I think, during the pandemic, we have changed that a little bit because, we no longer had tourists for quite some time. And so we actually found some landlords that before would only rent to tourists, and they needed the income. So they opened their doors to some of our folks, and they realized that, with a subsidy for many programs came support for the landlord, whether that was through IHS's navigation case managers or outreach workers. And that has been seen as a very positive for many landlords. And I would, put the pitch out there that we really need more landlords. We really need more units, because what it comes down to is it's great that we're providing services, but if there's nowhere to house folks, even if we have the money to house them, if there's nowhere to house them, we're not going to solve the issue of homelessness on Oahu. Any other thoughts on what we're seeing come down? We haven't seen the huge plunge of evictions that we were expecting yet, but I do believe, and I'm not sure what anybody's else's opinions on this, I do believe that a lot of people, their next resort after losing possible housing is to double up with family and friends. And that tends to lead to future homelessness when those relationships get strained, or if the landlord kicks the entire family plus the doubling up folks out because they're not on the lease. But we do anticipate that we'll see more and more folks be evicted over the next several months. Any other thoughts on that?
Yeah, and Laura, I think I want to say that even though we may not be seeing people being evicted, I think there are people being displaced from housing or having to move or relocate. And I think what we need to be mindful of, again, looking at past history, right? Following the last recession, you didn't see people immediately go from eviction to homelessness right away. It usually takes some time. And that's why I'm saying what we have to expect is not a sudden one-time spike, but a gradual increase. And we need to focus, like I said, on looking at how to help people on the employment end and workforce development end, but also on the housing end. How do we quickly make those connections back to housing?
Yes, I completely agree. We've just got a few minutes left. And so I know we're gonna, did we lose Connie? We might have lost Connie. There she is. Okay. All right. Any last thoughts that anybody would like to bring up that they would like our audience to know?
I would say something that, Laura, I think that one of the big things that, I think that everyone's going to benefit from a program like Honu as well is that just in the vein of your last question, we've seen a shift of, in the beginning, Honu for about the first 1,000 people or so they were easy to case manage and navigate. And then the next group of people during the pandemic, we saw a huge influx of singles with high mental illness rates, people that were in crisis quite a bit at the site. And now we're getting a lot of families. So when to the point of the evictions, in the last 2 weeks, we've actually had a family of 8 and then a family of 10 that came in. And then we had a 8-month-old infant, and we've had a lot of little kids in the site. So we're seeing a lot of families. And I know some of them lost their living arrangements. I don't know if it was official eviction or what it was, but it's kind of, we see these shifts in our statistics. So I don't know what it's going to look like after the pandemic, but it does worry me because with 99 people, I mean, you can only expand so much. Yeah.
Thank you, Dan. And we had another question from Diane, and I don't think we can have an actual answer for this, but what was the impact of COVID, the actual virus itself, on our folks? I do not believe, and Scott, you can correct me if I'm wrong, but I do not believe Department of Health distinguishes their numbers amongst those who are homeless versus those who are not. But we have seen outbreaks in different shelters. But I am very happy to say that by and large, we have not seen a huge impact of true sickness, true COVID sickness amongst a large group of those experiencing homelessness. At the beginning of the pandemic, we were really expecting a huge breakout, and we did not see that. I will say with complete sincerity that I give all that credit to the outreach workers who work tirelessly to educate folks out in the streets, on the beaches, to really educate them on how to best protect themselves. I went out fully Tyvek'd up, to encampments with different groups to really educate and get testing done. When we found folks who were tested positive, again, education was a huge part. I know, Connie, you had some outbreaks in your shelter, and unfortunately, you actually lost one of your team members to COVID last year, which was extremely unfortunate. But the larger picture, we've not seen a huge outbreak. Does anybody have any other comments on that?
I think I want to just do a shout out to one of our colleagues, Project Vision Hawaii, because they absolutely were the heroes, in this whole thing, because they provided the testing at the beginning and then the vaccinations that really just made such a huge difference, especially for us in congregate shelters. And I also wanted to thank Dan too for post Honu, because when we shut down, they actually took the overflow of the people that normally would come to us. And I felt like, okay, when they're ready to come and when we're open again, they would come back. And certainly that's the way that it's been working. I did want to mention one more thing in response to the question about the Alice households. What I've begun to see is that people are more and more leaving Hawaii. And I think people really need to think about that, that if we do not make a full commitment to affordable housing development and, an economy that really pays a living wage, you're going to see a lot more people leaving Hawaii. And that's a sad thing for me, having been born and raised here.
I agree. And with that, I think that's, our plea for affordable housing, our plea for the community support. I'll now turn it over to Roger for the final words.
Well, thank you very much, everyone. That was really informative. And I don't think many people realize how much of your work that you do. This will go up on a YouTube channel, and it also goes out on Facebook, and then we will have it video edited for highlights, and it'll be up on our website for the next year, if not longer. So if anytime you want to tell people who ask you about what's going on, you can always say, go look at the website at Hawaii Book and Music Festival, and you'll see a video of a really comprehensive discussion of what we're doing. Thank you again very much. It was extremely worthwhile. Aloha.
Thank you all. Thank you all for tuning in, and have a wonderful night.
Aloha.